My name's John Forde. I'm a consultant in public health for Coventry City Council. I'm really interested in resilience because I see it as a key marker of a child's overall well-being and health and well-being, and also a key marker in terms of their life chances moving forward. There are plenty of opportunities for us to look at what works around improving resilience through the services that we commission, but also I think there's a role for public health in promoting partnership working. So really interested in working with schools, working with families, working with young people together around how can we take, for instance, a whole school approach to promoting health and well-being. And there's much made of system leadership and integrated working, but given the environment that we're operating in at the moment around some of the strong financial challenges in the public sector, but also some of the emerging evidence base around the importance of integration, and actually if you get it right, you've got an opportunity to improve outcomes for children. So the response, I think, should be about, at a strategic level, understanding what our key outcome measures are for improving health and well-being in children, and understanding how important resilience is in that. And then also understanding the evidence around what works in terms of intervention, and then also looking at developing and testing new models, new integrated models, working with schools and communities and families and children to test that out in terms of can we do better around those outcomes. I mean, we are at the beginning of working with a number of schools in the city. The model we're looking at developing is a drawdown model rather than a refer into model that enables good relationships to be built with schools and families and communities. The model is predicated on services being more visible and more accessible, services being integrated, so working with schools, developing strong relationships with schools, with children, with young people and with families in their communities, and understanding from their point of view what has worked well in the past from our services, what hasn't worked so well, and how we can coordinate better to deliver better and be really clear about what are the outcomes that we want to achieve. That way we believe we've got a better chance of improving outcomes.